Garcia. Today we're talking about the amalgam tray setup and steps. So first, we will walk our patient into the room and review their health history. If they are taking any medications, or if they're still taking medications from before, if they have any allergies, and make sure we get all of that down into the file for the next time that they come in. So then we will have our basic tray setup, which is the mouth mirror. This is for indirect vision and to retract lips or cheeks. Then we have the Explorer. This is to examine the tooth for decay. Then we have the cotton pliers to grasp or transfer items from in or out of the mouth. Then we have HVE tip. This is to remove large amounts of debris or saliva. Then we have our saliva ejector, which is mainly used to eject saliva from the mouth. Then we have our amalgam setup, which comes with a Toffenmeyer. It is to hold the band and maintain stability. These are the matrix bands. These are to replace missing proximal walls. Then we have our wedges. These are to hold the matrix band along with the gingiva. Then we have our liner applicator to place the dental liner once our tooth is getting prepared. Then we have our Whitson to carry or place temporary restorative. Then we have our amalgam well. This is to hold the amalgam before it is placed. Then we have our condenser. This is to pack the amalgam. This is the condenser, sorry. Condenser. This will be the amalgam carrier. This is to carry and dispense amalgam. Then we have our burnishers. This is to smooth out the amalgam once it is placed. Then we have our discoid carver. This is to carve the occlusal anatomy once we have placed everything to make sure it's smooth and flat. Then we have our hole and back. This is to contour and carve the occlusal the surface. Then we have articulating paper and the articulator paper holder. The articulating paper is to hold on to the articulating paper so it won't move, and the paper is to check for the bite if it's high or low. Then we explain the procedure to the patient and we sign the consent form, answer any concerns or questions. And I, as a dental assistant, will be applying the topical anesthetic in the area we will be injecting, and I will use the cotton tip applicator for him. Then we will assemble the syringe, attach the needle first, and then place the local anesthetic. We will gain entry and remove decay with a high-speed handpiece using a 587 burr to gain entry and prepare tooth for filling. Once the decay is removed, the dentist will inform me if the patient needs a base or a liner. We will need the Dyco applicator, the Dyco instrument, and the mixing pad. And we'll place the Toffenmeyer with the matrix band, of course, and place the wedge. The RDA, or the dentist, will place this. I, as the dentist, as the assistant, will mix the amalgam in the amalgam well, then pick it up in the amalgam carrier and load it with the amalgam. Make sure to place my index finger on the lever and make sure it is not pushed and packed with the amalgam. Then I will hand it to the dentist, and if the dentist needs more amalgam, I will just keep on mixing more and handing it to him. The doctor will smooth out the amalgam and carve the anatomy. Then we make sure the margins are secure. We remove the matrix band and the Toffenmeyer. The doctor will continue to carve the anatomy to make sure it is okay. Once the doctor is finished, we will take the articulating paper and check the bite of the patient, and it will indicate if the patient is biting high or if the amalgam is overfilled. The doctor might also recommend for us to use floss to check the patient. And once everything is set up, we will dismiss the patient